Namaste. Welcome one and all to my YouTube channel. My name is Dr.Simran and today's topic is the most severe thing that the entire country is suffering from. That is the coronavirus. Okay. So today I'm gonna explain you about the vaccination that is available for the coronavirus, and also I will be helping you to register with the COVID vaccination. Okay. So first of all, to begin with, what coronavirus is. So coronavirus is an acute respiratory syndrome that is affecting many of the individuals in our country, leading to severe symptoms in some individuals and also death in severe cases. Okay, so since we have an alternative, and since we have the vaccination which has come up, okay, which has been invented for us, we should definitely go up for the vaccination and should not believe in any of the WhatsApp forward messages, nor should you believe on any other myths that says that girls cannot take the vaccination when they are in periods, that pregnant women cannot take vaccination, then old age people cannot take vaccinations, and many such myths. So please do not believe in any of these myths, and since you have an opportunity of taking this vaccination, I would request all of you to please go and take the vaccination. Okay, so what is vaccine? Okay, let me explain you that first. So vaccine is a substance which is introduced in your body, and it produces antibodies and helps to improve your immune systems, okay, when you have severe infections, right? So that is why we have this vaccine that has been invented for us. Now, as all of you all know, we have two types of vaccines that are available, that is the covaxin and the covishield. Okay, so first of all, I will be comparing both the vaccines, that is the covaxin and the covishield. Okay, so the covaxin is developed by the Bharat Biotech in collaboration with the Indian Council of Medical Research. Okay, so this covaxin is taken by the SARS COVID-2 strain itself, which is an inactivated virus. Okay, so what does inactivated virus mean? That is a genetic material of the coronavirus, that is the RNA, okay, is inactivated by heat or a chemical reaction. Okay, so what happens is when this is introduced in your body, okay, it acts like the COVID virus that you get when you're really infected, and the body gets used to it and it prepares antibodies. So when you are going to be affected by the virus, definitely there are going to be auto antibodies which will be generated in your body, right? So that was about the covaxin. Now I'll be speaking about the covishield. Okay, so what is covishield? Covishield is like a virus taken from the chimpanzee gene. Okay, so here this virus, it is not the COVID virus that is taken, it is a chimpanzee adenovirus that is taken. Okay, and here it acts like a vector. Okay, so what is a vector? Here it is introduced in the human body, and it creates spike proteins on the surface of the virus. So this spike proteins again helps our body to develop antibodies against the virus that will infect us in the future. So of course this is going to again help you to develop antibodies. So guys, let me tell you that people are telling that we are getting COVID even after we are taking the vaccination. Yes, there are chances of getting the COVID after taking the vaccination as well. But let me tell you, the symptoms and the severity is negligible. Like, it's really very low. Okay, so as you all know that the oxygen, the oxygen reading, the oximeter reading, that has to be above 95, right? So if you're taking this vaccine, at least you're getting a lesser amount of symptoms, wherein you don't have to really run for ICU beds, where you know that there is really too much shortage of these beds and hospital admissions that are going on. So to lessen this, why not just take a vaccine and get infected with lesser symptoms as compared to the actual COVID virus symptoms that we are going to get in the future. Okay, so definitely this is a better option of getting vaccinated. So I would request all of you all to please go and take this vaccination and do not avoid it. Okay. Now, this was about a vaccination, and let me tell you that the better one between Covishield and covaxin is, I will tell you the efficacy level of both of them. Okay, so the covishield vaccine has an efficacy of around 78% after the first dose and 100% after the second dose. And as compared to covaxin, it has 86% efficacy rate after the first dose and again 100% after the second dose. So of course with covaxin you have a little less amount of side effects that you get. So the studies have proved that covaxin is being a better one as compared to covishield. Okay, so now everybody knows that like above 18 after the 1st of May everybody is going to be eligible for the vaccine. So I would please request again and again to everybody to go and get this vaccination done. Okay, now I'll be explaining you how to register for the vaccination. Okay, so you have several apps and you have several sites that you can actually register yourself for the COVID vaccination. Okay, that's the Arogya Setu app, the COVID app. Okay, the COVID app itself has a little of technical glitches if you go and see, but you can actually go on to the COVID page on your Google website. Okay, and what you do is you open the COVID page and then you get an option of register or login. Okay, so when you click on register or login, you are gonna get an option of entering your mobile number. So you will enter your 10-digit mobile number. After you've entered your 10-digit mobile number, the next step is it will ask you for an OTP. So of course you're going to get an OTP on a registered mobile number. You're going to enter that OTP. That's how you register yourself. So under each number you can actually register 4 beneficiaries. That is, you can really register 4 people with a single mobile number, right? Then you get an option of selecting your photo ID card. So you can select your Aadhaar card, your driving license, your PAN card, any ID is okay. Yes, then you select your photo ID. After that, you're gonna enter all your personal details, your name, your address, your age, right? And then you get an option of selecting your nearby city. Okay, you have an option of PIN code, which will automatically drive you to the next page showing you all the nearby vaccination centers that you have. And the other one is also selecting an option for the state or the district where you live in. Okay, so that is how you can select your day, on what day you want to get vaccinated, and also you have the timings available for the vaccination. So it is according to you. You can select your date and your time that is convenient for you. Okay, and let me explain you that now after the 1st of May there are going to be a lot of changes with the costing part of the vaccine. Okay, so first it was available for 250 rupees in the private hospitals and for free in government hospitals. Now after the 1st of May there has been a change in the price of both the vaccines. So the Covishield is going to be available for 400 rupees in the government hospital and 600 rupees for the private hospitals for each dose. Okay, and the covaxin is going to be available for 600 rupees in government hospitals and 1200 rupees in the private hospitals for each dose again, right? So as you know, you have 2 doses to be taken. The first dose followed by the second dose, which can be taken within 8 weeks, that is after 28 days and within 56 days. Okay, so let me tell you again that it's not that you're not going to get affected by the coronavirus, but at least the symptoms are going to be mild. So please listen to me and go get yourself registered and take the vaccination as soon as possible. So let me explain you the side effects that you get after the vaccination. So you're going to get like a little, very little symptoms like fatigue, headache, body pain and fever. Okay, and sometimes there's going to be a little pain on the site of injection, right? There can be redness, swelling, but please don't forget that you do not have to apply anything warm from outside. You just take a normal painkiller after the vaccine, and the side effects only last for 1 or 2 days, not more than that. Okay, and what precautions you can take before going for the vaccination is, I advise you all to sleep properly before the vaccination. I advise you all to eat properly before the vaccination, maintain your blood pressure and sugar levels, And also don't forget to inform the doctor if you are allergic from any of the drugs, okay? And avoid NSAIDs, that's a drug, and avoid antihistamines also, right? So these are some of the drugs that you should also avoid while you're going for the vaccination, right? So that's all. Again, I'll be requesting all of you all that please go and take your vaccinations, right? So thank you so much, and please wait for my next video where I'm going to inform you all about the RT-PCR test, okay? What is it and how exactly the procedure is about the test, right? So till then, take care and see you next time in my next video. And yes, please don't forget to share, like and subscribe my YouTube channel for further such videos. Thank you.